Welcome to the Collective NP Clinic's Mental Health Literacy Library, Antidepressants, What to Know. I'm your host, Kara Leonard. So what are antidepressants? Well, this is a class of medication used to treat symptoms of depression, but it's also used in anxiety and pain and sometimes even in treating insomnia. Antidepressants are one of the most prescribed classes of medication in the United States, and some of our newer antidepressants are more effective and have fewer side effects. So there are different types. Selective serotonin reuptake inhibitors, also known as SSRIs, are the most popular and widely used. These are also often first-line treatment for depression. Lexapro and Zoloft are common in this group. Serotonin norepinephrine reuptake inhibitors, or SNRIs, is another group of antidepressant that also works on norepinephrine in addition to serotonin, increasing these levels in the brain. Cymbalta and Effexor are common in this group. Norepinephrine dopamine reuptake inhibitors, or NDRIs, are a newer group of antidepressant medication, and you might recognize Wellbutrin in this group. Serotonin modulators, these actually change the activity of serotonin in the brain, whereas the other groups we discussed increase the levels of serotonin in the brain. Viibryd and Deseril are common in this group. Another group worth mentioning are tricyclic antidepressants, or TCAs. This is an older type of medication that comes with a lot of side effects, and so these are often used as a last resort when other medications have been ineffective in treating symptoms of depression. So some common side effects to antidepressants can be upset stomach, like nausea, vomiting, and diarrhea, headache, appetite changes, and even some weight changes. Sexual dysfunction is a common side effect of antidepressants and often the one that's most problematic for patients and really threatens adherence to this type of medication. Keep in mind that different antidepressants are going to have different side effect profiles, and these are really just broad side effects that cover the entire class. Always report any side effects to your provider. Some important facts about antidepressants. These can take some time to work. So some people can feel relief in 2 to 4 weeks, but sometimes it can take up to 3 months for full therapeutic effect to be felt. So you gotta give these medications time. Sleep and appetite, energy and concentration, these usually improve before the mood does. Dosages of antidepressants start low and are titrated up based on symptom improvement and patient response, but typically slowly. As with any medication, always take it every day as prescribed. Never stop taking your medication abruptly or without consulting your provider. When antidepressants are stopped abruptly, it can actually lead to something called discontinuation syndrome, which can feel like a bad flu, but also have symptoms such as delirium and maybe even hallucinations. So always take your medication regularly and never stop abruptly without consulting your provider. Some people may only need antidepressant medication for a limited time, maybe weeks or months, depending on symptoms. Some might need it for a longer period of time. This just depends on your symptoms and how the medication is working for you. Thank you so much. We hope this was helpful.